Welcome to Raaonline. Today's topic is about vaccines in pregnancy. So vaccination is it plays a very important role in the normal adult healthcare and especially pregnant women. So vaccinating a pregnant woman not only protects her from infectious diseases but also helps in this transplacental transfer of antibodies that plays a very important role in preventing the early neonatal deaths, early neonatal mortalities and morbidity. So as Nelson Mandela correctly told, life or death of a young child, it depends upon whether he or she is born in a country where vaccine is available or not. So let's move into the topic. So introduction, vaccination plays a very important role in antenatal care and management. The obstetrician, gynaecologist and other obstetric care providers should routinely assess the pregnancy patient's vaccination status, and studies indicate that there's 50% increased chance of a woman getting vaccinated if she is advised by her OBGYN. There is no evidence of adverse fetal effects from vaccinating pregnant women with inactivated virus, bacterial vaccines or toxoids. So all live vaccines are contraindicated. Usually what we give is inactivated vaccines in the form of toxoids. So usually in maternal immunization, antibodies are transferred across the placenta, providing a passive immunity to the newborn child. And this passive immunity, this antibody transfer is high. It's around 20 to 30% around after 32 weeks. So after 32 weeks, the IgG transfer from the maternal side through the placenta to the baby is high. So that is why certain vaccines are advised to get it done at the third trimester, that is usually after 32 weeks. So you can see here, the placental transfer of IgG is generally linear with largest amount transferred in the third trimester. So when she is pregnant, there is no transfer. It usually starts to increase around 13th week and 5 to 10% around 17 to 22 week, and the peak is usually after 32 weeks. So what does CDC say is that the benefits of vaccinating pregnant women usually outweighs potential risk when the likelihood of disease exposure is high. So CDC says that you can vaccinate a pregnant woman if the vaccine is totally safe, if it doesn't cause harm, and you can vaccinate the pregnant woman if the exposure to that particular disease is very high, or that exposure or that infection would cause serious mortality and morbidity. CDC advises it's totally safe to vaccinate a pregnant woman until and unless if the vaccine doesn't cause any harm. So these are the vaccines which can be given. Given in pregnancies. So the first thing is, in India, what we give is TT, which has been replaced to tetanus. TT has been replaced to TD. And in special situations, we can give a hepatitis A, hepatitis B, meningococcal and pneumococcal. All these are in special conditions. This vaccine which we routinely give, and this after COVID vaccines were given during the COVID period. Flu vaccines can be given. Inactivated flu vaccines can given in the flu seasons. And all these live vaccines, HPV, measles, mumps, rubella, everything, it's contraindicated. So this is contraindicated in pregnancies, but they can be given postpartum. So you can see. So this flu vaccines, if it is indicated, you can give, and certain vaccines can be given during pregnancy. But you see, X means indicates that it can be given. So see, all vaccines, they can be given during breastfeeding period. So there is no contraindication that this vaccine can be given or this vaccine cannot be given. All vaccines are safe during breastfeeding. So that is one point you have to remember.